Yo, what is up, everyone? Welcome back. Taking on another walk in the Hudson Valley here. It's been a hard week. I stayed from 9 to 9 at my 9 to 5 job multiple times this week. And today I finally got out early enough that the sky is still bright enough, so we are going to make a video. So today, what I'd like to talk about are the three general archetypes that I've seen in medicine. And I don't think these are the only archetypes that are present, but I think a lot of people in general fall into one of these three. And I would say I personally transitioned from one to the next, and maybe there's yet another archetype that I will transition to at a later time. I don't know, we'll see. So the first archetype, which I think a lot of people going into medicine tend to become, or they are before they even go into medicine, is the savior. What's a savior? Self-explanatory. You go into medicine because you want to save people. You want to help people. You want to save people. It's a very noble cause. And there's nothing wrong with that. However, what I realized was the cost of that was my own well-being and the ability for me to separate what I do versus my life. I was constantly taking work home and constantly having trouble sleeping to the point where I'll start with telling my story, I guess. As a first-year intern in medicine, you're kind of told to have responsibility and have patient ownership, and that's drilled into you constantly. So as an intern, I would be so scared of not being there for my patients, because in my mind I had to save everyone, that I would get there early. Hell, I would pre-chart on my day off before my first day on shift. Get there early, sometimes 1 or 2 hours early, and stay until sometimes as late as 11 p.m. at night. So my day sometimes would look like get in at 4:30 and leave when it was 9, 10, 11 p.m. And what I was realizing was I was making my work so much of who I am because I wanted to save people, that it consumed me, so that even when I went home after those grueling hours, my mind was still focused on the patients, and I couldn't leave them behind. I couldn't leave them behind in the hospital. So when I would be dead tired, hair still wet from my shower, and I lie down on my pillow, and all I can think about once I close my eyes were my patients. So that was my savior phase, hell-bent on saving everyone. And I can tell a story. One night, one of those nights that I ended up staying until 11 p.m. I was finishing up work. I probably would have gone home at around 9. And of course, efficiency played a role in it too. My need to be perfect and to be complete over being efficient. That played a role in how late I stayed. So that night, I was on track to finish at around 9 p.m. And then, right as I was finishing up my last patient note, a nurse texts me and says, "Hey, one of your patients is not doing very good and might need to go to the ICU." But she's refusing. She's refusing to go to the ICU. The husband's at the bedside. He doesn't know what to do. He's trying to convince her to go. And I was so tired. I wanted to go home, but my sense of responsibility over that patient kept me at work, even though I had already handed her off to the night team. And the night team was already offering to take care of it for me. I said, no, I'll do it for myself. So I go to bedside and I bargain with her. Please, I know you want to live. Please go to the ICU. Please let us start vasopressors or medications to keep your blood pressure up. Let us start these for you. Please consider surgery. She had an infection in her abdomen that needed surgery to fix, and she was getting really sick from severe sepsis. And I knew enough at that point that if she did not get surgery or go to the ICU within 24 hours, she was most likely going to die. And so I was panicking. I was more invested than she was. By this point, she was confused. We call that encephalopathy from the sepsis. And she just kept on telling me, I'll think about it. I'll make my decision tomorrow. And I knew that if she had waited, there would be no tomorrow. So I tried so hard. I bargained with her, and no luck. So I turned towards my second option, which is to talk to the husband, who desperately wanted the same thing as I did for her. And I gave him instructions and said, listen, I don't think she's in the right mind to make decisions for herself, even though ICU refused to take her because she refused to go to the ICU. I told him, listen, the moment she loses consciousness, we're going to have ICU come back, and please, let them take her to the ICU. Let them start these medications. Let them take her to surgery. Let them save her life. And of course, the husband was on board with this because he didn't know what else to do. Luckily, that was one of the cases where ultimately everything worked out. She went to surgery, she survived. It was a long hospital course, and a few years later, I saw her in an outpatient setting. Just by random chance, I saw her and I said, wow, you're still alive. And you look great. So that was my savior phase. That was one of the success stories with that mindset. There were definitely many more negative outcomes and bad outcomes, or outcomes that I don't personally consider was a success. But that one stuck with me because it was. I don't regret doing that for her. And I'm glad at that time my mindset was such that even though she did have to suffer a little bit more, she survived and she went on to live more meaningful years that she otherwise wouldn't have gotten if we had just said, all right, we'll listen to her. Don't take her to the ICU. Don't do surgery. Just let her die. The danger with the savior mindset is it just burns you out. I was getting so tired without realizing how tired I was becoming. And it was not sustainable. So eventually, out of pure survival instinct, I subconsciously shifted towards the mentality of I want to call it a buffet worker or a buffet owner, right? Come and I'll offer you everything we can do and you pick and choose what you would like. Don't ask me, you pick and choose for yourself. And because of misguided instructions, I was steered that way. And I always thought that, hey, maybe I'm not supposed to actually interfere with people's decision making like that. So I should give them I thought that was what giving people autonomy. I thought that's what it meant, is to completely just give people the choices and whatever they want. I literally would say, it's kind of like a buffet. You pick what you want and you don't get what you don't want. That's it, simple as that. Well, that had its problems too. In doing so, I came to figure it out that I stopped really caring or connecting with my patients as much. And it became more about just checking off the list, recording what they said, and moving on to the next so then I can go home. Plus side is I slept better. Slept better when I was in my quote-unquote savior phase. But I started feeling detached from what I was doing. The sense of responsibility started waning, and I probably started making more mistakes. Of course, I can't know for sure because at that time, my insight was pretty poor. And then comes the third phase. The third phase was that of a guide. And this is something that I only figured out 3-4 years ago. It was as I was finishing up my third year of residency and transitioning into fellowship in palliative medicine that I started to rethink what my role as a physician is. I'm not someone whose job is to, I like to call it, ruthlessly save everyone, because that's not sustainable. And sometimes that's just flat out not right for people. But I also didn't want to be someone who just laid out the choices and let people blindly pick for themselves, even though they're picking bad choices for themselves. And so, without putting a label on it, I became more of a guide. I started asking people what actually matters to them, so then I could try to put myself in their shoes and come up with options for them that tied in as closely as possible with their goals and what's important to them. And that's the phase I'm in now. And that's largely what palliative care is. If you think of, and I just realized that I never defined what palliative care is, and perhaps I should do a video defining what palliative care is. In my eyes, I'm an internal medicine trained doctor, and I've been blessed with the knowledge, the gift of that knowledge, and my role is to use that knowledge to help educate my patients and help them make good decisions, good informed decisions in their lives. And that is currently where I've settled. I don't really believe that a good doctor can be much better than the archetype of a guide. You just continue to hone your craft as a guide, and you continue learning, continue to hone your knowledge, your medical knowledge, keep up with the medical knowledge, but also you learn how to talk to people. You learn the different kinds of personalities that you can expect to run into, and you start being able to gauge how to approach people with your advice. And one of the things that I learned that's most important when you're giving advice is the fact that you should ask permission when you give advice. It's never something that you just blurt out, especially true when you're giving bad news. You always want to ask permission. And that's what a good guide does, is gauge when and how ready someone is to hear what you have to say. And that's a tough thing to do in medicine. Sometimes we feel obligated to just say everything that we know to people, and what happens is that overwhelms them with information and they go into analysis paralysis mode. So I realize that I am the filter. As their guide, I am the filter between what is important and what is not. And so my approach is always to look at the big picture, make sure that they understand the big picture and still would like to know more, and then proceed filling in the gaps with more detailed information and more detailed plans for them to choose what is right for them. And that's where I'm at today. So I'd be curious to know, because I think this extends far beyond just medicine. I'm sure this applies to many aspects in life and many different professions. So I'd be curious to know what archetype you fall into. Do you think there are more than that? If you do, let me know. I would love to know more. All right, that's it for today. Peace out.